Yeah, we've talked a lot about PPPs already, so I don't want to go there. But given the challenges of continuity in government policies, how can PPP agreements be structured to ensure long-term stability beyond one political cycle?
Okay, thank you very much. That's a really interesting question. My background is law, so health ethics and law consulting is a law firm that works in the health space. We've done quite a bit of work in the public-private partnership agreement structuring. As you know, in Nigeria, we have public-private partnership laws, both at the federal level and at the state level. And in fact, some of the work that we did supported some of the work that some others have done, like you know, they adopt a primary healthcare facility initiative. We did the legal work for that. In doing the work for that, actually, I think one of the things that was very clear to us is that we do have, you know, the legal framework in place that allows us to structure agreements, whether we're talking, greenfield, we're talking other types of partnerships. What we don't have is a structure that recognizes the peculiarities of the healthcare space. So we do have a PPP policy, a PPP in health policy, but it's 20 years old. So all of this stuff that we have around with all the conversations we've had today, for example, around digital health, are not addressed in that at all. Some of the incentives that you would love to see government give within the PPP structure are not necessarily captured in law. So we've done that. I mean, there are various examples, whether you look at LUT at that cancer center there, or you look at the federal level, some of the initiatives. You go to Akwa Ibom State, they've had some PPPs as well. But it would be helpful if we were to review some of those pieces of legislation now and say what might be really challenging for a private health organization to do within the structure that we have in place. So if you ask me, I think one of the things that maybe should come out of this conference is a review of that PPP in health policy, which will then eventually, hopefully when we review it, will then be domesticated at the state level and help to guide, even if we do not review the PPP laws, will become part of the instruments that we look at when we draft PPP agreements. That will help us, because the question you asked me was about sustainability, is about how do we move, from one government to the other. The legal frameworks always help with that. So for example, we talk about the Basic Healthcare Provision Fund. We talk about that because, back 20 years ago, somebody said, let's have a National Health Act, etc., etc. We can keep improving on it, but we have the laws. When the government comes, the CSOs say, please make sure you budget for the Basic Healthcare Provision Fund. So in the same way, right, as we get to 2026, which will make it 10 years since we had our national health policy, I think that it's important to go back and look at that PPP in health policy, right, to help us. There are a few things I could say about the legal framework itself, but let's start with that policy. And of course, in terms of structuring, I'm sure that we have enough capacity within the HFN to support any kind of structuring of agreements that we need to do.
So I take it that you're giving us an assignment.
Absolutely.
So please take note. We've been given an assignment to go back and look at the PPP in health policy. He said it's 10 years old now and needs to be revised.
10 years, so it's 20 years.
20 years, sorry.
2005.
Yeah, 20 years old and then needs to be revised.